for a spike up, like around the shoulder, and I'm also going to show you around the hip. All right. So for ankle and elbow, knee, you wouldn't use those most of the time. Okay. This is a 2-inch, and it's kind of I don't have a lot of these, but this is kind of a 2-inch, and I think it's a 2-inch double length. It's very, very long. Here's a 3-inch versus a 4-inch versus a 6-inch. Okay, single length bandage. Most of the time, we would use a 6-inch on the knee. If you were doing an NFL guy, you might do 6-inch double length. But for most patients, you could use 6-inch on the knee, maybe 6-inch on the ankle if you had a large ankle. Okay, probably more commonly using a 4-inch on the ankle. You would use a 3-inch or a 2-inch up on the wrist. Okay, if you were doing the elbow, probably a 4 or 6, depending upon the size of the elbow. All right, so you would have to kind of make that decision. All right, Miss Caitlin, you have to move your ankle or move your body that way, foot. Keep coming. I want you all the way out to your calf. Keep coming. Right there, perfect. Perfect. All right, you can bend this knee. All right. So if I'm going to do her ankle, and I think I demonstrated this when we were doing cryotherapy, but probably with her I would use a 4, okay, and start distal, and when you get around here, anchor it by using your dog ear. So pull that down and then overlap it again, okay? You would want to try to compress, hold your ankle by there, a little bit more here, and then when you get up towards the ankle, you're going to do a figure 8 pattern. So around the ankle, or the lower leg, and then around the ankle. Around the lower leg, and around the ankle. And then back. The last of your wrap is going to be right here. Thanks so much. Piece of tape. Again, you might have those Velcro type wraps that just kind of Velcro on there. You could use a little clips, just make sure that you're extremely cautious and that you're not digging those into the skin. I normally do not use those, okay? So 4-inch ankle wrap, starting distal, working proximal, overlapping. Kind of see this little diamond here as they overlap in the front, and that's pretty good. You can do a what they call just an overlapping spiral. If you don't want the figure 8 pattern, you can just do this. Come around, do your dog ear, and then just kind of keep wrapping.
Is the figure 8 better, like on movement?
I think you get a little bit more compression. Notice I have a little bit more wrap to go up. I probably didn't get as much compression down here. Okay, so either way is fine, really. Elastic wrapping used to be an art or a skill that we did a little bit more. It's really more common today, at least in most clinics, to use tuba grip. You pull it off, it's like our stockinette. You pull it off, cut off the length that you need, and slide it on like a sock. And you have the compression that you need. So you may not use a lot of elastic bandages, but you may. Okay?
It's the same wrap you'll use like on an Una boot, though.
Right.
It's the same type of wrapping skill you need to do the Una boot.
So when we're doing the Una boot, which we talked briefly about on Monday for venous insufficiency or venous wounds, it's about like this. You take it out of a package, and it's kind of wet, cool, and clammy because it's got zinc oxide, which is like a calamine lotion on it, okay? And you would start down here, and you would overlap this stuff, just like you're doing with here. And sometimes you have to go a figure 8 around it, and then you just keep wrapping all the way up with your Una boot. Normally you definitely want your Una boot to go all the way up to that kind of tibial tuberosity, so we go a little higher, and then you would put, typically you would put your, what is that stuff?
Kerlix.
Kerlix, which is like a spongy wrap, and then you put your Coban over the top of that, okay? So anyway, the wrapping techniques that we're doing will help you as we do a little bit more. And even when you're doing wounds, I mean, you're going to have to use some type of gauze. Almost always there's a spiral type of thing that you're trying to hold it on. Okay? All right, now scoot back. Pretty loose.
How far?
All right there's perfect. All right. And let's just, we'll use this knee. So bend, if your knee, no, right there, it's perfect. All right. If we were going to do a knee, and so we had a knee sprain, all right, and we had a little bit of swelling, and we're trying to reduce the swelling. 6-inch would probably work best, and so I would start. You know, you could have her, you know, elevated like this, or you could have her slightly flexed. Start below distal, and we would wrap over the skin, not on her slits. But overlapping, here's my dog ear, like we did before. And just like we did the ankle, you could just do overlapping a half or so, and taking your wrap up, and finishing on mid-thigh. Normally you wrap about the same distance below the knee to above the knee. So if you get 4 to 6 inches below, then hopefully your wrap will go 4 to 6 inches above. Okay. Again, if you had a really large patient, and most patients are bigger than all of us in this room, you potentially could use a double length 6-inch, but it's going to be pretty long. I mean, if I use this on Caitlin, I mean, it would go all the way up to her hip. All right, so you'd probably have too much. So a single length 6-inch bandage probably works best for most knees. Tuba grip works a lot better. We can just slide it on. Okay, I think anyway. Good. Okay, and anchor that with tape as well. All right, why don't you go ahead and sit up for me?
Or you could do a figure 8 on that.
Oh yeah, let me try that. Oh yeah, let me do that one more time. Thanks. I knew there was something else that I wanted to.
And on the competency, we would like to see figure 8s on all your joints, because you can do the spiral. Anybody can do that.
So
Figure
do you
8's a little
figure eight on
better.
the competency, do you want us to get the heel covered good too?
Yeah, try to. It's an easy, I miss it sometimes. It's an easy place to miss.
Yeah.
Heels don't swell much.
Right,
So that's a good thing.
right.
Your figure 8 on the knee, again, start below, overlap, there's your dog ear. Now as you come up here, now I'm getting close to the knee, I'm going to go across the front of the knee. Now I'm going to be around her femur. Okay, come back around, and now I'm going back down around her lower leg. So there's my figure 8 pattern. And I ended below instead of above. Okay, just wrap it around. This helps it hold, helps it to be a little bit more stable, doesn't fall off as often, okay? All right, scoot out to the end.
Like this thing.
Mhm.
Wait,
Carry it. Sit up there. Perfect. All right. This isn't meant to sit on the end. Shoulder spica. We've done this before. I'll show again. Don't worry, you're not going anywhere. Oh, perfect. Let me use your other arm so everyone can see it better. So, now you're fine. You're fine. So if I had a ice bag or a hot pack or something here with your shoulder spica, you could use on most people in this room, you could probably do the 4-inch double length. Because we're not using it really for support or for compression, for the most part, it's just to hold something in. The 6-inch is great. So start on the arm, maybe once or twice around. My little dog ear, there he is. So, okay, and now what we want to do is we put our ice bag there, or we put our hot pack, and again we're going to go over the shoulder. Put your left arm up. There you go. Around the thorax. You should over the shoulder and around the thorax or the trunk. Over the shoulder. Now, if you were, I mean, I've actually used this for AC sprain. So, someone who has an acromioclavicular sprain, you develop you fabricate a pad for the shoulder, and typically these are football players, and then so they can put their shoulder pads on, and then I would use this wrap all the way. I get down here, I would use my tape, maybe go around the bicep, and I would tape it on so it stays secure, so this pad is there for the whole football game, okay? We did it in lab, we got our ice bag on there, and we're done. We can just kind of do this number, tuck it in, so your ice bag or your hot pack stays in place for your 10 to 20 minutes, and then you can take it off, okay? shoulder spica figure 8 pattern. If I was using it, I've actually, I guess I have used it a little bit with, for posture. Let me show you one difference. Here, roll this up for me. Pretty please. The way I did this with Caitlin, I started here and I pulled her shoulder forward. See that? So kind of collapsing her, not in the best posture. So if I was going to have someone wear this for any activity, I would probably do it the opposite. So I would be pulling her shoulders backwards, okay, getting her improved. So I would start around here so that when I went around her trunk, I was going this way. So pulling her shoulders into more of a retraction position, like that, versus what I had done before. All right, so just the direction that you pull it, okay? Questions on that? All right, let's talk about the elbow. All right, elbow is very much like the knee, obviously. 4 or 6 inch, and start below the elbow. Dog ear it. Figure 8 pattern just means kind of come up here, around the distal humerus, then back around the forearm, and then back up. Hold your palm, there you go. And then finish the wrap up here. Just like with the knee, you would typically want to have as much wrap above as you do below the joint. Okay, and that is just for swelling, holding something in place. With a wrist, you have a couple options. You could use this 2-inch wrap, which is, there's going to be excess wrap, or you could use a 3-inch. I'll show you both, okay? So if you had a wrist sprain, typically, obviously this is where your swelling is going to be from about your fingers, metatarsals, metacarpals, to as high as you can on the forearm where the wrap will take you. So you could anchor around your wrist, don't pull too hard there, and then come back down on the palm. Notice you might have to fold this wrap to get through the palm because your hand's not real big, and then try not to have too many wrinkles. And then hold right there. There you go. You guys have student athletic trainers when you were at Linton? All these football players had to tape themselves.
Yeah, we had a doctor on the sidelines and like a guy.
He didn't tape it in.
No.
Doctors, they're too good.
They just stand around.
Yeah, they stand around. Look good.
We had Kevin.
We had Kevin Ritz.
Yeah.
Yep.
We had Sandy, but he wasn't certified. He was a paper guy.
There you go.
He was like a grade dad.
Taper guy. That's how athletic training got started. All right, so there's your 3-inch wrap. All right. Up. Now the 2-inch wrap, again, you're going to have excessive wrap, but I think it gives you some flexibility in going around the thumb. All right, so you could start here.
This year, though, we actually had a physical therapist on that.
Oh, you did. Where that was?
His weird name. Like Barrett Goodman.
No, watch.
She's in Latin.
So hold her thumb up, all right, and you could do a spica around the thumb. See that? So here's the bottom. Around the wrist is one part of the 8. Around the thumb is the other part of the 8, like that. Okay. And then you could take the rest of the wrap up the wrist, but notice again you have probably more than you need. Okay. And then again, anchor with tape. Okay. You ever met a girl up there? Her name is Karen Smith. She's a physical therapist. Maybe you. She was in my PT class. Her she was from Greene County, so and her last name was Green before she got married, so she was Karen Green from Greene County. I remember her.
This girl might have been a teacher member, but that's on the side.
All right, one more. We're gonna do hip spica. Okay, I want you to stand up. Not on the table.
I really put the dent in this
Fall
thing.
off. Face, here, come over. Here's what I want you to do. I want you to stand forward with your foot like that, kind of heel up, perfect. All right, so if I'm gonna do a hip spica, I'm using her trunk and her thigh, all right? And I'm giving some support to the hip. And also think about your iliopsoas, your hip flexor. Sometimes patients have a hip flexor strain, and this wrap could be used for that, all right? So in this position, you would want to anchor on the leg, just like you anchored on the bicep. We don't like ankles, right? And dog ear it, okay? And then go around the leg a couple times. Now notice the way she's standing, which is helpful to get it on, but she's externally rotating. If you had, let's say, an adductor strain, it may hurt to go that way. What I'm going to do with her wrap is I'm going to pull her across this way, just like I talked about with the position of your shoulder. You can actually, rotate her in. So once you've anchored it around the thigh, you're going to try to cross right in the front of the hip. So bring this around here, and you like to get this above her iliac crest, otherwise it'll fall down on you. All right, so here you go, and across there, and across here. If you were doing this on an athlete, you could put it underneath their sliding shorts are on, but their uniform's not on. I mean, I have never done this with a traditional physical therapy patient, to be honest with you. But here is how the wrap looks, okay? So this could be, you could use this to hold hip. You know what a hip pointer is? Everyone feel your iliac crest? If you land right on that, or someone's football helmet hits you right there, it doesn't feel good, and you can get a lot of swelling. There's a lot of muscle tissue that connects there. So you could put a pad there for protection and use this hip spica to hold it in place. Okay? You could use it to hold an ice bag in place. You could also use it to support the hip flexor, okay? Or your adductor. Even the adductor pain there, if you pull it across there into adduction, it doesn't hurt as much when they're walking, okay? Another one of these, right behind you. All right, turn and face that way. Now step back with that same right foot. Pull your foot in just a little bit right there. If she had a hamstring, or let's say a gluteal hip extensor strain, you could use the wrap and put it on just like you just did, but in this position, you're gonna pull her backwards, alleviating some of the pressure on her hamstrings. So you would start the wrap just like you did on the thigh, 2 or 3 times around, and now bring your spica around, and the cross is going to be over their buttock instead of their anterior hip. All right, so just like this. Nice colorful shirt on. Greene County. All right, and then you could tape. All right. So here I'm supporting hip. Actually, you can put your foot back down. A lot of times I'll have them stand on something here, like lift your heel up, like they would stand like that. All right, just a little bit of extension. Okay. So hip extensor, hamstring wrap versus if you turn back around. If I had it in the front like I did the first time, hip flexor, adductor wrap. Okay, hip spica. You do not have to do the shoulder spica or the hip spica in the competency. Okay, but I do want you to practice it once there. Okay, just so you've seen it. And normally that's going to be a double length wrap on those. Okay, no one, not even a kid, could use a single length wrap and have enough to go around. Okay, so I demonstrated the ankle, the knee, the wrist, elbow. Those are the 4 that could be on your competency. Spicas, no.